I'm going to talk about the 14 most common symptoms of the coronavirus for patients who are actually admitted to the hospital. And I'm going to have the least common up front and the most common symptom at the end of the video. So do stick around and keep a note of all of these symptoms. Anyways, number 14, abdominal pain, stomach pain, and about 8% of patients in the hospital, sick enough to be in the hospital, get stomach pains, abdominal pain. Now, if you do have it and you do have the coronavirus, then you are actually at a higher risk of developing a more severe form of the disease. Next, number 13 is going to be vomiting. If you're vomiting, you can be part of the 8% of patients who actually present to the hospital with complaints of vomiting, and they also have the coronavirus. Now, these patients are also at an increased risk of developing a more severe form of the disease, so keep note. Number 12, headache. And who likes headache? So people can develop headache in the coronavirus as well, and around 6 to 8% of the people can develop a headache with the coronavirus. Number 11, dizziness. So you feel like you are spinning. Now, around 5 to 20 to 25% of patients can have dizziness. They are spinning in their head. And if you do have dizziness, then you are again slightly more likely to have a more severe form of the disease. So these things are very important to know. Now, we're going to be up in the top 10 now. Nausea. Nausea is number 10. And if you feel nauseous, you are amongst the 11% of the patients who may feel nauseous with the coronavirus infection. Now, moving on with the countdown, number 9 is going to be diarrhea. Now, diarrhea could be in up to 16% of the patients, and diarrhea again is one of the symptoms that predisposes you to have a more severe form of the disease if you do have the coronavirus. Now, guys, you must have noted that abdominal pain, vomiting, nausea, diarrhea, not nausea, but diarrhea, all of these stomach symptoms actually do predispose you to develop a more severe form of the disease. So these things, of course, need to be kept in mind by the regular people as well as by the physicians and the healthcare staff as well. Now, moving forward, number 8, pharyngeal pain or throat pain. That is also a symptom, and around 11 to 35% of patients can develop throat symptoms or pain in the throat with the coronavirus. And if you do have throat pain, then that does put you at a higher risk of having a more severe form of the disease. Please note. Now, moving forward, continuing on with this, expectoration. If you are able to produce phlegm, if you have sputum coming up, then that is also one of the symptoms of the coronavirus. And up to around roughly around 28%, 30% of patients can develop this symptom as well. Now, number 6, moving forward, number 6 is going to be a very important symptom because it has a great, it provides great evidence of what type of disease you have. If you have shortness of breath, dyspnea, shortness of breath, then you are much, much more likely to have a severe form of the disease. And around, let's say 20 to 60, 65% of patients do develop the symptoms of shortness of breath. You have air hunger. And if you do have air hunger, shortness of breath, it's much, much more likely that you have developed a pneumonia with the coronavirus, with the COVID-19. And a lot of people do present with this. Now, number 5, we are amongst the top 5. So this is muscle aches, myalgias. You feel aches all over the body, your muscles are aching, and as you are noticing, these symptoms are fairly common with the regular flu, the regular cold symptoms that we all get every year. So that's why it is very difficult sometimes to differentiate the coronavirus from the regular viruses that are already out there. So number 5 was muscle aches. Moving forward, number 4. And this one is poor appetite. You do not feel like eating. You may even lose your sense of taste as well as smell. So this happens a lot in patients as well. And let me step back a little. It has been said that about 20% of patients, 10 to 20% of patients may actually lose their sense of smell as well. So I just incorporated this into my list that I'm remembering right now. Now, top three, yes, finally here. Number 3 is the symptom that everybody talks about, the dry cough. This gives you dry cough, and this is very typical. And if you've listened to a couple, and then you can almost say for certain, hey, this person has the coronavirus, and it is that specific, this dry cough. And around 60% of patients coming to the hospital, admitted to the hospital, can have this dry cough sensation. Now the top two, number 2 is going to be fatigue. Now that is apparently a symptom, and you may think, you're of course going to have fatigue. You're of course going to be tired if you're having the coronavirus or all of these symptoms. You're of course going to be tired, but we clinicians, we want to quantify these and see who has it and who does not have it. So around 60 to 80% of the people can have the symptom of fatigue. But guys, as you see, that a lot of these symptoms overlap with regular viruses and flus and colds that we have. So that's why sometimes, and initially it used to be difficult to differentiate, but now we're getting smarter and we can pick these things. We can differentiate a coronavirus patient from a different type of virus patient. Even clinically, doctors who've experienced enough can actually do that. Now, number 1, I think you guessed it. You can guess it. You can guess it probably by now. Number 1 is going to be the fever. All right, so everybody talks about the fever. So almost everybody coming to the hospital sick enough has a fever. Almost 100% have a fever. At 100% because some people may not note their temperature at home, but they may feel warm. So they may not have documented a fever, but they definitely must have felt warm or similar symptoms at home. So again, these are the symptoms, all these symptoms: abdominal pain, vomiting, headache, dizziness, nausea, diarrhea, throat pain, back of your throat, shortness of breath, muscle pain, lack of appetite, dry cough, weakness, lethargy, fatigue, and fever. So these symptoms may be absent in a quarter of the population, and 25% of the people actually do not have any symptoms at all. So that is a very significant feature with this coronavirus epidemic, the pandemic that we are noticing. So, and a vast majority of patients may have very mild symptoms that you may not even feel remarkably. And these were the symptoms of patients and the percentages that I talked about for those people who are actually coming to the hospital. And this is good information, so we can try to make a differentiation, and also this is important for the healthcare staff to know as well. Anyways, anybody having any combination, of course, have to make sure and talk to your doctor and talk to your ER if you feel like you have to come to the hospital and if you have any severe symptoms. Anyways, I want to share this list of symptoms with you guys. Let me know in the comments below, and let me know what you think. Give me a thumbs up, and of course subscribe. I'll have videos, and I have been having videos on the coronavirus and what we can do, and what is the latest updates on the viruses and the information from all over the world. So stay tuned, subscribe, and share this information with everybody else. Talk to you guys soon. Bye bye.